Aloha mai. Thank you again for joining us for the second half of our third segment on healthcare on the Big Island. In our first half-hour segment, we were able to address the recently passed legislation with Chairman of the Senate Health Committee, David Ige, and he provided, I think, some very good information to all of you and to us about what the legislation will do for, particularly for the state hospital system on the Big Island, the Hawaii Health Systems Corporation. And now, as kind of a follow-up to that, we would like to have and have invited key managers and directors for not only the two acute care hospitals, but also someone who has great knowledge about the community health centers to join us and to talk about how this legislation may positively and or negatively affect them, and what other needs do they foresee going forward. So I'm very pleased to have them participate with us today. And Earl, why don't we start with you? Just introduce yourself.
Sure. Aloha, Earl Greenia, the CEO for the West Hawaii region of HHSC, which consists of both Kona Community Hospital and Kohala Hospital.
Aloha, my name is Beth Giesting, and I work for the Hawaii Primary Care Association, which is the association of the 14 community health centers across the state.
Aloha, Howard Ainsley, CEO for the East Hawaii region, which includes Hanaka'a and Ka'u hospitals, as well as Hilo Medical Center.
Aloha, Josh Green, Senator from West Hawaii, and I was Vice Chairman under David, Chairman Ige in the Health Committee this year, and serve, of course, with Senator Kokubun representing the Big Island Caucus.
Great. Thank you all so much for joining us today. Beth, I'd like to start with you. I mean, you did mention the number of community health centers across the state, but if you could you just focus on the Big Island ones and just identify them for us?
Certainly, I would be happy to.
Great.
And our 3 community health centers on the Big Island are among the best and fastest growing in the state. Those 3 are Bay Clinic, which serves Hilo, Pahoa, Ka'u, and Kea'au. West Hawaii Community Health Center, which serves Kailua Kona and has recently opened a pediatric, dental, and medical facility in Kealakekua. And the Hamakua Health Center serving Honoka'a and Kapa'au in North Kohala.
Mm-hmm. Great. And we have recently discovered that there is some federal economic stimulus package money that has come to those facilities.
Yes, community health centers are funded directly by the federal government, and they recently were given an award of additional funding to help them to meet the expected increased demand for services during this time of economic upheaval. So over the course of the next 2 years, they have gotten an additional amount added to their grant. And they also are expecting to get a little bit of money coming up soon to help with capital needs.
Oh, great.
Mm-hmm.
I thought
it's wonderful to know. Go ahead, John.
I thought maybe we could also ask Beth to tell us a little bit about what health, well, 2 things, what health community health centers do, because from a state standpoint, the reason I think that Senator Kokubun and I have invited you is twofold. One, we often see all of our people with large needs, and the health centers are like the safety net, as our hospitals,
yes.
our Hawaii Health System Corporation is the safety net on the hospital level for us. So if you could tell people just, how many people do health centers need, and why the state government gets involved with them, it would be helpful.
Sure. Community health centers are private nonprofit organizations, and they're community-based, so they're not run by the state or by the federal government, but their funding comes from both the federal government and the state government, and they are established in areas that have additional recognized needs, places that are remote, places where there are a lot of people who are below poverty or have extraordinary needs for additional access services. So community health centers provide medical care, they provide mental health services, and they provide dental care. They fill in the blanks with a lot of those services by providing additional care and support for their patients, by providing case management services, help with applications for public insurance, or whatever the patient needs, really. Definitely hands-on help with any kind of health issue.
And you told me today, I think 1 in 5.
Yes, on the Big Island, 30,000, almost 31,000 people are being taken care of by the 3 health centers that I just mentioned. And that amounts to 1 in 5 Hawaii County residents are going to community health centers. And I have got to say that I think that the growth of community health centers and the more people that they take care of, the better for the whole system, because they provide such excellent care and are so very cost effective. So the communication or the partnership that we are talking about with the hospital corporation is going to be really a fabulous good thing.
Great. Well, Earl, maybe you can tell us a little bit about, Kona Community Hospital and perhaps how this legislation will benefit you.
Sure. Thank you, Senator Kokubun.